Well, today, the 988 National Suicide Hotline is up and running. It officially launched yesterday nationwide. It is meant to be a quick and accessible way for people in crisis to get certified mental health help. Call centers for the new suicide hotline number say the first weekend was a huge success. 5 on your side's Laura Barczewski talked with 2 organizations helping in this effort, and she joins us now in studio. Laura.
Mike, both groups I spoke with who are answering calls and texts through 988 say they had dozens more calls than a typical weekend, which means this new program is definitely working to help those in need. Provident Behavioral Health celebrated the state rollout of 988, the suicide hotline, and got right to work saying the increase in calls, quote, is evidence that the word is getting out about this new number and people recognize they need it. And the 988 dialing code is making it easier for people to reach out. They expected an uptick and staffed accordingly.
So I would easily say that we are in the top 5% of states that are a little bit more prepared and ready throughout the nation.
You can call or text 988 to be connected immediately to a mental health professional, something Marian McCord with Chad's Coalition for Mental Health says is so important at times when people feel alone.
I'm just excited for those people that are sitting in so much pain that they can easily connect to resources and get connected to help, because there's help and there's hope.
Lauren Moyer with Compass Health says 90% of callers just need someone to talk to and can be helped right there on the phone. But the other 10% need more intervention, and through 988, they can get that to them as well.
We're enhancing our mobile crisis response across the state. And that's where I can come to where you are in the moment versus calling a 911 officer to come to your home, or an ambulance to come to your home, or tell you to go to the emergency room.
And if a mobile response isn't enough, there's more steps beyond that, creating a whole continuum of care.
We have these behavioral health crisis centers in different areas of the state. We have 10 up and running now that we can use 24/7, 365 as an alternative to the emergency room.
Next, they hope to get geolocation software similar to what they use for 911 calls to get more precise locations of their callers to connect them with the closest call center to them at that moment. Now, if you're experiencing a mental crisis, need to talk, or are trying to help someone that is, all you have to do is call 988. Mike.
Laura, thanks.